Thanks for joining this webinar. We're going to kick off in a couple of minutes. So thanks for joining. We're going to kick off in a couple of minutes. Do grab an incredibly quick cuppa or whatever else you might need to do. We'll start really promptly in 2 minutes' time. It also gives time for any technical adjustments if any of you need those before logging in, but the system seems to be working well this morning, so fingers crossed. We'll make a start. Thank you for joining our webinar. We're extremely pleased you've been able to join on another beautiful day in Suffolk, our amazing county. I wanted to start by thanking our teachers. This is National Thank a Teachers Day, and I wanted to thank teachers for all they do and all they're about to do. Teaching, like safeguarding, is an all ages public service. Teachers are part of our extensive safeguarding network in Suffolk and play a key role in keeping children and young people safe. I'm Anthony Douglas. I'm the independent chair of the Suffolk Safeguarding Partnership. We're a statutory body made up of the main safeguarding agencies in the county: social care, education, the police and the health services, but also a much wider safeguarding network made up of countless smaller organisations, individual schools, individual playgroups, daycare centres, care homes, and our huge and brilliant voluntary and community sector. Literally thousands of you who keep vulnerable adults and children in Suffolk safe every day. I'm going to explain our morning's programme, which is part of our work in the partnership to deal with the most important safeguarding issues in real time, not to look backwards and find out everything that went wrong, but to be on top of it in the present and learn where we need to manoeuvre quickly. And that's never been as important as during the current COVID pandemic, when we need to be incredibly agile about our work. So I'm going to speak for about 15-20 minutes, giving you some input about the importance of safeguarding in the COVID period. Then I'm going to have a conversation with two of our practitioners who are going to talk about what it's been like for them working on the front line during the COVID period. At the same time, we're running a question and answer panel with 3 experts, and they are going to be taking questions and answers. And in the last 5 minutes of the webinar, I'll be summarising some of the main points coming out of that Q&A. So our panel is Christine Hodby from the CCG, and Nicola Bennett from Adult Social Care, and Sadie Cable from our partnership. So in the conversation pane, do ask a question, make a point, and be assured that it will be taken down and fed into this process, but also on the record permanently for when we write a summary of the webinar. We hope this is the first in a series. We hope you enjoy it. So the next slide is going to be about today's agenda, which is to focus really on blended safeguarding as we return to some degree of normality. And I'm going to spend a little bit of time talking about that, particularly the importance of keeping to established safeguarding principles and practice. They've lasted us well for 50 years. They haven't changed as a result of the pandemic. Abuse and neglect haven't suddenly stopped, but there are some crucial differences. And in terms of the messaging about that, we say in the partnership and put public messaging out: stay safe, see it, recognise it, report it. And that could be summarised in today's messaging style as stay alert, report abuse and neglect, and save lives. Safeguarding saves lives. We're a 24/7 multi-agency emergency service focusing on what is going on for people in their daily lives right now, and how, if they are being abused or neglected, that can be instantly stopped, or at the very least reduced to more manageable levels. This isn't a service where you book something and 6 weeks later you decide to do something about it. It is a life and death service. We're going to spend a little bit of time on the legislative updates that have been announced by the government in relation to the pandemic, but we won't spend too much time on that, because part of Suffolk's success is not to use any of the easements, as they're called, any of the flexibilities, apart from some delays in some related services, court hearings and the like. Generally, the standards have been maintained to a fantastic level, and so we haven't needed to introduce any structured delays, but I'll just cover what they might be. And then Linda and Rebecca, our two practitioners, are going to be talking about their own experiences. The next slide is a brief summary of the current situation of safeguarding in Suffolk. I would say our performance has been brilliant. It's been brilliant despite the risks being the same as everywhere else. And I just want to give a few examples of that. The first is the Home But Not Alone service, which has reached out to a group of vulnerable people who otherwise may not have been supported. The Tribe Volunteer app that is in use has had 1,800 new volunteers. That's massively important. The reports I've been receiving, and I receive them from all sources, are that generally people feel well supported. That's important to state. There are many risks about carer pressure, carer breakdown. We know from Suffolk Mind's emotional needs audit that many people feel a loss of meaning by the decline in the public space and being trapped in their private spaces. So individuals who do feel trapped, their experiences will be far worse. But generally, the sense, despite that rise in anxiety, which I'm worried might become an epidemic of anxiety, the general position is positive about support. The care homes in Suffolk, despite having the same issues as everywhere else, have had daily phone calls, good PPE and excellent problem solving. I'd like to pay tribute to colleagues like Sue Cook, who've organised that in an incredibly proactive way, given that nationally the picture is not of extreme proactive behaviour in relation to care homes. So the picture in Suffolk's good. I wouldn't worry too much about referrals being down. They always go down in times like this. So even though these are extraordinary times, they're not extraordinary. They follow a pattern, and you would expect to see referrals pick up again towards the autumn. And the real comparison will be the month-on-month increase in referrals from September, and the year-on-year comparison when we get perhaps to November. But although there is understandable worry that many people are not going to hospital for health treatments, many children who should be in school are not being in school, then there will undoubtedly be some safeguarding issues, some abuse and neglect not being picked up. I'm very reassured that what is being known is being picked up well. Significantly, a higher proportion of referrals are serious. It means that the most serious cases are probably still coming to attention. But what isn't is a whole lot of prevention work that in a far more normal times would be done. The next slide is going to be about the new norm. but I did want to just pause and pay particular tribute to the innumerable acts of local kindness and caring that have been taking place. And just kicking off the next slide about the new normal, what I think would be wonderful is if that safeguarding work carried out by the everyday army of safeguarders that we now have in place is carried on as business as usual. Examples are the welfare calls to vulnerable people who are being shielded, mostly older people and people with disabilities, complex needs. Those welfare calls that could continue after the pandemic, perhaps through the release of the time now being done by GPs on mainstream video and audio consultations. So we have to look at what's happened during the lockdown period and to not worry too much about the disorientation, because of course some people are trapped exactly where they were on the 23rd of March, but try to accelerate our way out of it. And also at the same time, this point about cycles is important, that this may not be the end of the pandemic, and you'll know from all you've been reading and talking about that there may be several cycles of infection requiring a repeated tightening and relaxation of suppression measures. Nothing could be guaranteed. So as we work now, that rhythm, and particularly with remote intervention, is important to normalise. I want to highlight some of the advantages of remote intervention as well as some of its downsides. Attendance at conferences has never been better. It's easier, particularly using Microsoft Teams, Skype to some extent, but less so technically. It's easier for people to log in, perhaps even for half an hour, 20 minutes, make a contribution to a conference or review than the extensive travel time that might normally be involved. So we must normalise the ways of handling conferences and reviews. Many vulnerable individuals tell us they are able to talk more effectively on the phone, Skype, WhatsApp, and so on. Clearly, with profound disabilities or with profound dementia, some of that isn't possible. But certainly the advantages of technology are obvious and they need to be maintained. Zoom has expanded from 11 million users before the lockdown to 455 million users today. And their security has got a little bit better. So it is important to take immediate steps, as the universities have done, to put all of their learning and teaching online so that there's no drop in access to learning, and to think through carefully what can be done remotely. Obviously, with social distancing and the need for many face-to-face visits with vulnerable people and people at risk, it's not possible to practice 2-meter distancing all the time, but that should always be the starting point. But safeguarding work depends upon close contact, proximity, communication and engagement. And that does need to, from time to time, be close, but obviously taking the appropriate precautions. It can't always be done, even when it's necessary. And finding out when to be able to do that. I think the work that's being done in terms of risk assessments every day now will stand us in good stead for handling that issue as we go forward. In relation to lived experience, the work of safeguarding is always to get as close as possible to the daily lived experience of the adult at risk. And to do that, normally we would do much more work face-to-face. Of course, that's still possible in hospitals, care homes, but it's not possible in field work to the same extent. So we will be dependent upon the voluntary sector, the community sector, and what I'm calling the everyday army of safeguarders. So to support that more distributed and managed network of people who've been involved will be crucial. Otherwise they'll go away. Just as some volunteers went away when they signed up nationally because there was nothing in place for them to do. And it's just as in foster care, some foster carers disappear, if there's no one placed with them. So whoever you look after, you need to have a meaning and a purpose about it. So one of our main tasks is to make sure we capitalise on all that extra support from the everyday army of safeguarders, but make their roles clear and adequately supported with oversight. To encourage all of you with personal judgment, safeguarding has always been about personal judgment, never more so than today, because working from home most of the time, for most of us, means you are in a very different space. You're not in a public space, you're not in an ambience where this is being talked about informally all of the time. Organisations are much looser affiliations, and there's much more emphasis on personal motivation and judgment. We're in more of a permanent duty service. If you look at the rise in helplines, the structure of future services is likely to be much more remote intervention, use of helplines, a permanent duty service, and then some specialist field work, and the current level of support to care homes and other centres that has been possible during the pandemic. So that with the restrictions to getting close to the lived experience that come with the new normal, we're still using the team around the adult at risk to get there. So person-centred work and all the gains in safeguarding work with adults that have come from 50 years of deinstitutionalisation, 50 years of personalisation, 50 years almost of person-centred care are set out in our Suffolk safeguarding framework for adults at risk, and also in our Making Safeguarding Personal work. And we're going to be carrying that on, I hope, through future webinars, perhaps monthly, as a permanent fixture. We'll of course only do that if feedback from this one suggests that's sensible. And in terms of messaging, again, finally, we need to simplify what we do so that if you are more loosely affiliated to your organisation, or you are a volunteer out there, that the communication is using text, Skype, something simple, and that it's clear and straightforward. That's going to be hugely important. There are huge risks. I'd just like to commend the work of the Communities Collaborative Board, the Collaborative Communities Board, but also draw attention, as others have, to the risk to the voluntary and community sector over the next 6 to 12 months. Huge financial risks. So this vital everyday army of safeguarders needs to be supported. We need to find corporate ways of making sure the crucial organisations don't go under. Our next slide is about the legislative changes. I think all I want to say about that is the emphasis is still on the current framework, pre the 23rd of March. Nothing has changed. What is being allowed by central government is some flexibility to prioritise differently, to delay if that's safe, and to work proportionately, particularly on the administrative side. But crucially, there's no change to the Care Act and its predecessor acts. There's no change to the Mental Capacity Act, although some slight variation to procedures around DOLS, deprivation of liberty assessments. No change to the Human Rights Act, no change to the Equalities Act. As I've said earlier in the webinar, one of the brilliant aspects of working in Suffolk is to see how those easements haven't been needed through the sheer round-the-clock dedication of all the individuals working in safeguarding. That dedication has meant that we've been able to become more resilient as a result of working through the pandemic, to find some new ways of working and to keep our confidence about the services being provided. We have a task of restoring some confidence to individuals who, as I've said, are adrift, disoriented, anxious for all sorts of reasons. There are concerns about rises in domestic abuse, in mental health. That's quite predictable. I think we'll see these rises go on, but I think we'll have more of a steady increase than a spike. And what we must do is to, in the autumn, take stock of where we are compared to last year. So we've got a great opportunity to combine the best of existing practice with the variations to practice in the pandemic that have come about because we're in an enforced transition. So with that, I'm going to introduce our two practitioners. Linda Good, who's a best interest assessor and a senior practitioner in our DOLS team, and Rebecca Hughes, who is a consultant social worker in adult safeguarding. And I'm going to just ask Linda and Rebecca some questions so that for your benefit, there's a clearer sense of what this has been like on the front line, and it links with my input so that Linda and Rebecca can talk about what's worked well, what's not worked so well, what can be kept on permanently, and what our future challenges are. So I'm going to start asking Linda and Rebecca, just to say firstly, hello, thanks very much for coming.
Morning.
Hello, morning.
And you're live now. So the first question is, for both of you, and just go one after the other, feel your way into that. What's been challenging during the pandemic?
I think for me, this is Linda speaking now, it's been that we can't actually walk into a building because with dolls, etc., we're obviously looking at hospitals and care homes, etc., and use our instincts and our sense of the senses we use, like sense of smell and visual things. We're having to depend on somebody from that building describing what's going on. And I think it makes a practitioner feel quite uneasy that they're not able to meet with the person they're supporting.
Mm.
I think it's the same for me. It's Rebecca speaking. Like an example being a care home where we had quite significant concerns, and it's finding new ways of working. So we had been in there really quite regularly prior to the lockdown, and so had obviously families and friends, and we suddenly lost all those, the eyes and ears on the service. So it's a case of relying on, much better multi-agency work and people who are still going in there, like district nurses, GPs, etc., have a really good communication with them, and telephone calls, calling out of hours to check staffing levels. It's just other ways of keeping that eye on the service to make sure it is safe without actually being able to go in there.
I think the other thing that's been challenging for me particularly, and I'm just thinking about a conversation I had yesterday with a mother who has underlying mental health problems, and she's going into meltdown because she can't see her 21-year-old son with severe learning disabilities. So it's part of our work has been about supporting the people we're contacting, who we hope to use as a means of finding out what's going on, and actually they're in crisis as well.
Yes, turning to what's been going well and what's been innovative that could be carried forward after the restrictions are eased, what would you both say about the changes to your practice which could be carried on?
I think we've been communicating in ways that we'd forgotten we could communicate in. So, for example, with that 21-year-old I'm talking about, he actually uses technology in his everyday life because that's the way he's been brought up at that age, and he's able to introduce that option to his family and to us. And then the other end of the spectrum, a 92-year-old woman who's got dual sensory issues, we've been writing letters, which I think we'd forgotten how to do, and she's been responding in writing using her enormous magnifying glass. So we've been bringing back things that we haven't been using before, I think.
Thank you.
I think for us in safeguarding, it's a case of, there's no doubt visits are time consuming, and considering other ways to check on services, like talking to actual residents in the care home, talking to other professionals to get feedback is obviously saving a lot of time. And meetings have been really successful, and I've spoken to colleagues in the multi-agency safeguarding hub, and they've said they are used to not seeing people face to face, but they are finding that they're being really creative in different ways of communicating. So for example, like younger people, more text, they are using video calls. They're finding that people are more available because they're at home a little bit more. They're able to have really in-depth conversations where they're getting a lot more information than they might normally get. So there are positives going forward.
I think a colleague of mine also talked about having a manager of a home or a worker in a home taking a laptop around the home, so it's showing all the aspects of the home you would normally see, and then walking into the room of the person who was in isolation, so the person could see, you could see each other on the screen, which was quite helpful. Not as effective as actually being there, but it was the best we could do.
Could you both just give a couple of examples, looking at both of those questions, about a challenging situation and how that was dealt with? And then in relation to going forward, you've given one or two examples, but just as many examples as possible too, which then brings the work to life.
I've been working with one particular lady who was in it's a domestic violence situation, and she has left the abusive partner, which was wonderful. But the problem is then obviously she has gone to this flat which was very sparse, and she suddenly, the lockdown happened, and whereas she really needed a lot of support and she needed to furnish the flat, she needed, it was a real challenge, and she was frustrated, extremely isolated. But then actually other organisations have been brilliant in adapting their service, so she has still managed to get a level of support. It's slightly different to what it would have been, but she's been really appreciative. People like Turning Point, people Leading Lives are still going ahead, where they're all still supporting people in the best way they can, and she's been really appreciative of that. So
one more example.
I could give the example of, again, the 92-year-old 92-year-old woman who was taken into hospital and couldn't be discharged home where she would normally have been supported, because the home needed a lot of work done on it for her to return. She'd put her home on the market and everybody had been furloughed, the solicitors and the estate agents, so she lost her buyer. And actually, quite sadly, I suspect that she will end up remaining in residential care, because the opportunity to help her to return to a new home where she's independent is being lost. So it's not necessarily a good news story, but it just shows you all the things that can happen during a period when with a pandemic, when nothing is available to help that person to return home and remain independent.
Yes, and some of the points you've made are coming through the Q&A, the parallel Q&A. Moving on, we've talked about the different rhythm of working after the lockdown, and therefore also the different rhythm for the people we work with who are at risk, who are also at home most of the time, if not all of it, if they're shielded. So can we just explore a little bit that different rhythm, and how, by starting with how you feel as practitioners, what it's made you feel, the transition you've had to make, the adjustments, the good and bad of that, and going forward, how we might best help the professional community recover as we go forward.
Goodness, that's a really difficult one, because what we're going to just be emerging into is high anxiety from all angles. It's a bit like we're looking forward to not having to be isolated, but actually changing that is going to be quite anxiety raising for everybody. So I don't think we really know what we're going to be walking into, to be perfectly honest. And I think the most important thing for me is to remain talking to each other in great depth, empathy, curiosity, making sure that when we're talking to somebody that we would normally be asking questions of, that we actually listen to what they're trying to say to us, and at an emotional level, and trying to deal with all of that together, rather than just going in and returning to how we were before.
Do you feel any different, Linda, now on the 20th of May than you did on the 23rd of March?
Oh, very much so. Yes, I think what we've actually done is honed our instincts. We were, I think, a little bit institutionalized into what sometimes could appear to be quite oppressive practice in processing people through a system. We've had to step back and think about how we do it differently, and I think a lot of us probably are quite pleased with the results we've had. And I, for example, am now a lot better at picking up the phone to speak to somebody, because I'm prepared for something different coming down the line. People need us as much as we need them. And I'm thinking of the mother who was in high anxiety, who I would normally be asking to do things. And in fact, she was asking me to do things, and I was able to support her with advocacy, etc., to enable her to remain, well, less anxious, I suppose. So there are lots of things. I think the way we approach other people, the way we use different technologies. I, for example, have learned so much about how to use technology to assess somebody, and actually we need to keep those things. Some of them won't be necessary, but we need to keep them as additions to our toolkit rather than things that we use when there's an emergency.
I think it's also considering, like, because the level of safeguarding referrals has come down, but abuse is obviously still happening. My colleagues at the Central Safeguarding team have been looking at ways of, keeping eyes and ears open, thinking outside the box. People like gas engineers who are going into people's home, and maintenance people, from housing associations, who might go home and say, oh, the state of this place, the food was out of date, it was hoarded, it was dangerous, but not actually think to put that safeguarding in. And they're looking at ways to, make an awareness to those people that actually, it's as simple as going online and putting a referral through, or making a phone call to report those concerns. So it's if there's several periods of lockdown, then we're still getting that information come through that we need to know about.
Yes, and can I ask you, Rebecca, the same question I asked Linda about how you feel today, 20th of May, compared to the 23rd of March, as a safeguarding professional?
It's very different. To begin with, it did feel a little bit frustrating, because I don't think, actually going, like, for an example, into that care home that I was talking about, actually being there and sensing the stress and anxiety from staff, and actually seeing it with your own eyes and smelling, and so you can't actually completely replicate that from a phone call or from a virtual gadget going around the home. But it's surprising, it has been really good to see other ways of working and to keep your eyes and ears open to make sure that those people are safe. And so I feel it's very different. To begin with, it was very frustrating, but feels really positive now that it's working really well moving forward.
And the second part of that question was how it feels for the people at risk. And sometimes they're hidden in plain sight. Now they might be hidden in plain sight and hidden out of sight, and their voices, which are indistinct at times, may not be seen or heard at all. So what's your sense when you're working with people, talking to them, of what they're going through?
That is a concern, and you do sometimes hear frustration in the situation, because people are missing their freedom and being able to offload on to friends and families that they might normally be able to do. But I do think that safeguarding plans have been put in place. As people are aware, there's been a lot of publicity about, if you are worried, who you can call. There's been mental health. There's been so much information shared with people so that they know the support is there if they need it, and they can refer. For an example is, we've shared with lots and lots of service users, if they need to call the police, there's this 5-5 option where the police, you can alert the police that you can't speak. We're really trying to make sure that we're using all the resources, and there are a lot of resources. So people are frustrated. It's not quite the same, but I think that there is that level of support still there for them.
I think the majority of people I've worked with are potentially people without the mental capacity to understand what they are missing at the moment. And most of my discussions have been with relatives who are concerned that they can't now scrutinise the hospital or home that their loved one is in. And I think one of the things for me, I noticed that I've been asking for access codes to look at records, because obviously we need to check things like MAR charts for medication and PRN medication, which may possibly be overused when people are at risk. and it's not possible to get an access code because records would be shared with other people. So there are things that we can do in the future that will make that more possible. Maybe isolating information so you can just look at one record when you're asking for records to be sent to you, which you can't visit the home and see.
Obviously, as practitioners working with risk, conflict, emotion, highly charged work, it's emotional labour that can be draining. We've known over decades the importance of support, supervision, high support, high trust, high challenge in relation to work. So can I ask you both, it's not a leading question, it's because it's important for practitioners, whatever their organisation, do you feel supported by your organisation in the work? And are there any lessons about how organisations can best support their frontline staff?
I have never felt so supported, I have to admit, since the lockdown. We were aware that we may be isolated, and I think very quickly set up all sorts of WhatsApp groups to discuss things. There's more spontaneity than, because we're working in isolation and a lot of us were working at home before. Some of the teams over the years have been a little more dispersed, so you don't get that spontaneous ability to feedback when you come back from a difficult case. But with the technology, it's actually possible to bring back a lot of that spontaneity and get support from colleagues who see your message and respond to you. And I do feel more supported because of technology. I miss seeing moving bodies, but
yes, a lot of people on the Q&A are saying that.
Yeah.
Okay, Linda, how about yourself?
That was
Rebecca,
me, sorry.
Yes, Rebecca, rather.
Yeah. Oh, very much the same. Obviously, supervision doesn't feel very much different. You know, you have Skype, regular updates. As always, people are. It feels that people are more available if you do want to offload onto somebody. So I've felt, very supported. It's been good, and it is isolating. I do miss actually seeing people, but it's these regular catch-ups make you feel that you're still very much part of a team and you have that support.
Thank you. Then the final question we said we'd explore is looking forward, how we keep people safe in this uncertain environment, working in ambiguity, with masses of government guidance, but also masses of public anxiety, stories in the press. In a way, that's what we've always had to deal with in safeguarding work. My own view is there's no reason why standards shouldn't continue to improve despite the difficulties, and that we must be ambitious about this. So given we know we will have to work a little bit differently, the question I think for all of us is how we can accelerate that change. At the same time as everybody's very stressed, very strapped, very pressured, work will increase over the next few months. So normally 3 into 2 won't go. If you're going to do one thing brilliantly, you've got to drop something else. So going forward, what would you like to see accelerated and what would you like to see dropped so that we can keep people safe?
I think it's Rebecca speaking. We've had, especially the management within the team, a lot of attendance of other ACS team meetings to make sure that we are aware of other concerns, say, starting to come up in care homes, other trends that, may need safeguarding support. And for that to continue, to make sure that we find out as soon as possible so we can put support in, early before things escalate. And just really keeping a good network with other professionals, health colleagues, mental health workers. It's just keeping those conversations open, sharing information on a need-to-know basis so that we can make sure the support, the safeguardings are in place.
Linda?
Yeah, I agree with that. I think what seemed to happen at the beginning of this is every organisation went into overdrive to create a way of dealing with things that was specific to their own organisation. And I think we've gradually started to move together. I think there are still far too many people doing the same thing. But I think the way we've worked together has improved tremendously. I've had more contact with GPs, more contact with advocacy services, and I think the working together part has been really good. And it just needs to be honed down so it's not overlapping all the time, really.
I should also just finally ask you both about the situation in our care homes. I've been positive about the input that's gone into them, but clearly nationally there are major concerns about inappropriate discharges from hospital, lack of PPE, temporary workers moving between homes. In other words, that the sector hasn't been COVID proofed early enough. In your daily work, how would you assess the situation in Suffolk about that?
I think people have been very, very anxious and are slightly less anxious now. I've had what could, I suppose, amount to whistleblowing situations where people have felt uneasy about saying something, but because we've had the ability to feed those things back, for example, one home having people apply to them who are not happy with the way they're working in a different home because PPE isn't being managed very well. I think it's difficult because the homes themselves actually have they panicked a little bit at the beginning, I think, and then they were supported by our contracts people. But I was getting phone calls from homes who didn't know what to do about the potential for locking somebody in their room who was COVID positive, which is technically illegal, and how to manage that within the legal framework and the public health guidance. But I think homes have now gradually got more used to doing it, and they're understanding things a little better.
Yeah, I think that the care homes it's been really, really tough for them. And an example being that, just recently they've tried to follow some information from public health, and then a local GP has challenged that. And they're struggling because they want advice, direct, clear advice. But it seems that information is becoming a lot clearer for care homes now. And, Suffolk County Council, especially with PPE equipment, have had very clear guidelines. And, if you're struggling, you need to source it via this. And so they have had good support in that area.
I think
it hasn't been easy. Yeah,
it's about actually implementing those guidelines, because everybody is a different person and every situation is different, and it's how you interpret those guidelines within a person-centered way that they've struggled with quite a lot.
Yeah.
Thank you both enormously, Linda and Rebecca, for joining us today. Thanks also to the FAQ panel who've been working away behind the scenes. And as we draw the webinar to an end, we said we'd start at 10 and finish after 45 minutes, and we must keep to that timetable. It's important for me just to say 2 or 3 things. Firstly, thanks to all of you for joining. I hope you found it of some value in your work. If you do want to carry on that conversation, then do via the usual links, email, websites and so on, conversations. We're a conversation-based service that depends upon knowing what's going on and how best to deal with it and problem solve. There's further information available on our website, www.suffolksp.org.uk. We're increasing our social media output. That's, I think, well worth a look in terms of the messaging we're talking about. And we'll email you after this webinar with the relevant links. The webinar has been recorded, so we want to make it more widely available. And crucially, we, as I said at the start, may run more, perhaps monthly, but that will depend upon your feedback. And if your feedback is, well, forget this, do it some other way, we will. We'll respond to the feedback, including topics and themes for future webinars to keep them crucially relevant during the next few difficult months. So please give us your feedback. I think I'm right that on your screen you should see a link to a poll. So click it now to give that feedback. And then when I end the webinar, the link will disappear from your screen. So before I end the webinar, and we're no longer live, click on the link for feedback and it won't go. You'll have time to finish it after the webinar finishes or even later today. We'll respond to any unanswered questions as we can. We won't doctor the recording. It'll be as it is all the way through. It'll be on our website. So finally, thanks enormously again for joining us, and thank you for the work you're doing inspirationally to keep people in Suffolk safe. Goodbye.